Is it clear now? Am I able to present?
It's fine, so you can continue.
Clear? Okay. So thank you for inviting me on this session. And my topic is establishing and how to establish and run a naturopathy setting. It can be a clinic or a hospital with a minimalistic treatment. So I graduated from JSS Institute of Naturopathy and Yogic Science, but I learned naturopathy from the legend Dr. Babu Joseph, which he told to me that the basic rule one should follow is law of minimum and conservation of energy. That is which I kept with me. So the basic of entire presentation is this law of minimum and conservation of energy. So what is the basic requirement to start a naturopathy center, or what is the basic requirement to become a successful naturopathy physician? What you need to be with you to be a successful naturopathy physician? So first, it is knowledge. Knowledge of what? It is knowledge about everything happening around you, but the basic concept in naturopathy that diseases are broken biochemistry of cell. It is not the symptoms or the discomfort which one person experience, but when the normal function of the cell is affected, you get a disease. And the role of a naturopathy physician is bringing back the biochemistry near to normal or to normal as much as possible. Without this, you cannot become a naturopathy physician. That is my experience and learning. From knowledge, what you need is conviction. The conviction which we should have with us, then we should be able to give to every patient or everyone who came to us that you are not getting a disease because you didn't take any medicine. I have to repeat that. I have to repeat that in every class I take. You are not getting a disease because you didn't take a medicine. But even most of the naturopathy doctors are not convinced with this. That is why we tend to prescribe some herbal remedies to overcome, to bring change a disorder into order, which never happened. So you are not getting a disease, a diabetic, because you didn't take a metformin. You are getting a diabetes because you didn't eat well, you didn't sleep well, or you didn't exercise well, or you didn't manage your stress well. So you cannot reverse a diabetes with any medicine. Let it be a chemical medicine or a herbal medicine. You cannot reverse a disease because that is not the root cause of a disease. And third is passion and confidence. Basically, the confidence that body can heal itself when a chance is given. So if you have these three things with you, then you don't need anything else to become a naturopathy, successful yoga naturopathy physician. Pre-COVID, you might have needed some rooms, a space. Post-COVID, along with this, you need only a laptop, a good internet connection, and communication skill. That's enough. If you have all the things, then those are listening to this, who thus wish to start listening to this presentation with a wish to start a naturopathy center can leave. That's enough. Everything else is extra. If you look into online data, what is the rate of a normal physician if you do online consultation? It comes between 500 to 1,000. But for a naturopathy doctor, it's 2,500 to 3,000. So that's a difference, that's a scope, because we have to speak about money when we speak about success, become a successful professional, in whatever way you are working. So if you have this, then what else we can have extra to grow bigger. So let's see into it. So when you intend to start a naturopathy hospital, what you need is, you need money, but before that, you need a blueprint. A blueprint basically consisting of three things. what are you intended to do? That I will explain later, how it should be categorized and understand that. Then what is your story? It is the story which attracts people. What I am saying to you is a story of how to run a hospital. Then you have a service and there is many hundred people out there which need your service. What is your plan to reach them? So in my experience, what I understood is many people invest in naturopathy centers. Many people have the clinical knowledge and experience and expertise to run that, but they fail. They fail miserably because of lack of marketing techniques. When we start a naturopathy hospital, what mistake most of us do is invest our entire capital in making the setup. We don't make any reserve for marketing or to survive for next window period, the break-even period. If for a small center, it may from 3 months, and for a big center, it may extend up to 3 years. And the investment for that, for marketing and for surviving that break-in period is part of your capital. If you don't have that, when you become successful, when you become growing, and when people try getting know about you, and when people start coming for you, you may shut down your center. Don't do that stupidity. So you must have these 3 things before you look for a place, before you start making a program, before you start your center. And first thing is, what are you intended to do? In a naturopathy hospital, you should understand about the hierarchy of healing. What heals? As I said earlier, you are not getting disease because you take a medicine. So the role of a naturopathy doctor is to establish an optimum condition for healing, not to provide healing. Body heal itself when a chance is given. A role of a naturopathy center or a doctor is to provide that chance. So are you planning to just provide an optimum condition for healing? Or along with that, are you providing some treatments to stimulate and assist the healing power? So first basic thing is providing an opportunity for lifestyle modification, then providing some treatment to assist the natural healing power in the body. If you are including the second step, then you need to have some healing, some treatment centers, treatment equipments. Third, are you giving some specific treatments to address the weak organs or damage? Something like acupuncture or physiotherapy can be coming in that place. Or you're going to the worst part. We say big story, we don't treat the disease, but we treat the body. But sometimes we forget that and we go to address pathology, just addressing the pathology. Or it is not our result, and the final end of the therapeutic spectrum is suppress the symptom or surgically remove the pathology. That is, anyway, most of us are not going to do that. If you are trying to do that, we'll be behind bars. But in the first 4 category, where you are going to fit into, are you doing the best one, or are you going to include the next level also? So what are the things comes in each layer? So first thing is giving attention to basics. So diet, rest, exercise, and rhythm. I'll say one experience we had in my clinic few months back during the lockdown, during the entire pandemic is going on. When patients come to us during this time, we have a practice of taking them, doing a RT-PCR in the airport when they arrive, and quarantine them in a room till the result comes out. We do the consultation only next day morning. So one lady from Mumbai came to me, and she has a habit of poking her ears always with earbuds. And because of that, sometimes once in 6 months, she used to get ear infection, and she's forced to take antibiotics to get rid of that. So here, when she came, she was sitting simply, nothing to do at the room. So she again put earbuds. And on that day evening, she started getting ear pain. She know that because last 20 years, every 6 months, so 40 experience in getting an ear infection. She know, okay, ear infection is getting, she has to start taking antibiotic. So she waited. She thought she would start from next day morning. But fortunately, next day morning, the RT-PCR result came early morning. So she came out of the room for the consultation and the treatment started. On that day evening, she told me, "Doctor, something very surprising happened." What I asked? She said, "My ear infection went away itself without antibiotic. It is the first time it is happening in my life." I said, "Nothing surprising in that." I replied to her, because she was on our raw food diet from the moment she came here. So even in an infectious disease, so in the case of pandemic, even giving attention to the basic is important. No treatment was given there. It was just she was here in a good environment with basic diet and she was relaxed. So without that foundation, I believe in my experience, no naturopathy will work. So along with that, are you including elementary remedies like air, water, sun, and earth? It's very important. We cannot, in a practical level, if you run an IP center, you must include these things. Then mechanical remedies like manipulations, massage, physical therapies. And mental remedies is part of basically the return to nature itself, meditation, mind healing practices, placebo effects, very powerful tool. As we heard many times, the disease heal itself. We just take the money. We can use placebo effects very effectively. And are you giving some chemical remedies in form of herbs and nutraceuticals? So depending upon what is your intention, you should decide what are the categories you are including as part of the naturopathy healing program. Only after this, then you should thinking of investing in the center if you are running a clinic or an IP center. So what are the minimalistic choices? The minimalistic choices basically means which does not tax the vitality. Whatever you do, if tax the vitality, you're delaying the healing process. The body heal itself when a chance is given, and chance is nothing but rest, because vitality can repair and heal you when you take rest. So don't tax vitality. It is not the number of treatment. It is not what you do to them. Vitality is free? Is the body system is free to heal itself is an important question. Vitality, the freeing the vitality, not taxing the vitality, means reducing the impact on nature. There's nothing there in the nature which for our greed. So reduce, even when you give a hip bath, how much water we are wasting? Is it required minimum hip bath or a spinal bath? Can you reduce the number of hip bath given? It's important. So reduce the impact on the nature. Reduce the burden on investor. Cannot waste money. And support the healing and healer process. If the healing process is supported, as I repeatedly say, it is giving the rest and easy to learn and adopt with the patient. Why naturopathy was included in the program of Mahatma Gandhiji? Because we believe naturopathy can make a sustainable choice for the public of the general public of the common man of India. For any other system, the patient has to go back to doctor, relay the doctor or the physician every time they get a disease. But once a patient get educated, and even if he is able to give a sustainable lifestyle choices for them, then it is forever. Then you may think, how will get patients? We don't have to get the patient repeatedly. When a patient will discharge from here, I used to say to them, don't come back. The purpose of you coming here is not to come every year. You can come back again to reconnect, but don't come back the disease again. They can refer people for us. You don't have to worry about how the business will run if patient don't come back to us. So this is first part of minimalistic choices. And second part, obviously, is financial sustainability. When you're making an investment choices on treatment equipments, when it invest on a naturopathy hospital, the bulk investment come on the treatment equipments. One of the important things, now most of us invest is on colon hydrotherapy. Nothing wrong in that. That makes us to earn money. But when you look into the treatment aspect, when you look into the impact of the treatment, the colon hydrotherapy can be replaced by Negusanga Prakshalana? What are the advantages and disadvantages? What support you more? You have to make a choice. You cannot just buy colon hydrotherapy, keep it in your room, and you think that LSP can work better. If you believe, based on evidence and experiences, colon hydrotherapy has superior effect than LSP, okay, go for it. But make a choice. Then reduce the operational cost. Again, when you on an experience, I know when you run a naturopathy hospital, the cost come mostly on a human resource. Last week, I was helping one of our junior to make a hospital, to run a hospital of 3-bedroom. And the minimum human resources required when we calculated was to give in an ideal way was 8 or 9. 2 doctors, 4 therapists, one cook, 1 receptionist, and 1 housekeeping. You may think, why 2 doctors for 3 rooms for 6 patients? When the senior doctor taking leave, someone should be there for that. When a therapist being ill, we need a backup for that, because we cannot compromise on human resources when you give a high quality service or the treatment for the patient. So the ultimate is there should be a balance between investment and income. The minimalistic choices is which can be generate revenue and make profit. Profit is not the greed, but which help the organization to grow. Sustaining our organization is so important. So make these 2 choices, one on vitality, second on financial sustainability, when you think of establishing a naturopathy hospital. So on practical level, what are things are required? And these are the picture of my hospital, which I am working as Chief Medical Officer now, which is known as Prakriti Shakti, situated in a hilly region of Idukki, Panchalimeda, and where the nature is the biggest investment for us. When people landed, he said, we healed itself by the moment we landed here. So it is always better to, I know practically it might not be possible always, but always prefer a place which is cost effective, easy, and vitality friendly manner. We speak about negative ions many years back. Now, multinational companies are coming with equipments which produce negative ions to neutralize the virus. So this can be easily available if your hospital is located in a natural place. Along with that, I'll say what I have. So why this I'm showing is the hospital which I'm working now is catered to a high category people, where we charge minimum from 15,000 to 25,000. And what we give to them. To charge that, what we have this nature. Along with that, we have hydrotherapy. This is our hydrotherapy. 1 hip bath and spinal bath. We don't have anything else. So why I included, everyone has seen the hip bath, spinal bath picture, but many of my friends asked to send a picture of the hip bath and spinal bath settlement in our place, because how it is placed. So I just added that picture. Then this is our massage room with a normal steam bath cabin. And recently we included a sauna room also, and hip bath and massage, and a reflexology track, along with acupuncture. That is what we have in our hospital. So this is what provide. Then why people come to us? It is because how we explain the things to people, how we are able to connect our philosophy with the scientific knowledge, how much we are rooted and being scientific at the same time. So these are the certain terms we generally use with the people. We explain our naturopathy principles with these: toxemia, fasting, healing crisis, self-healing capacity of the body, naturopathy diet, and therapeutic yoga. We almost play with all these words whenever we speak to patients. These are time-tested philosophies, time-tested words, which we have firm beliefs. But are you able to connect these traditional concepts with the most modern outcome in the science? I'm purely a clinician. I'm not in the research field. But there are people out there who do research. There are people among us who bring that knowledge, who read that and say, to update us on a daily basis, read this paper. Are we able to read that and take the meaning and understanding of that and able to explain to a patient? Are we able to connect the toxemia with the scientific explanation of protein misfolding? In PubMed, the numbers in bracket are the paper available in PubMed on protein misfolding, or on each topic there. Are you able to explain the toxemia is a condition, nothing but when the protein we given to the body is of low quality, the protein which is supposed to fold in a healthy manner is getting misfolded, so the cell get damaged, the cell suicide by itself, which leads to damage of the organ. We say about fasting, paramaushadam, lankanam paramaushadam, fasting, why fasting heals? Because the vitality becomes free and body can heal. With that traditional sentence, are we able to explain how fasting really works on the cellular level, which inhibit the mTOR mechanism, which inhibit the cell division, so the autophagy get activates? As my topic is not to explain the science, I'm not going to anywhere. Oh, I'm not explaining this concept or the science of this concept. It's out there in the way, and you have many documents available that you can read that. Are you able to explain the healing crisis with connecting with the xenobiotic mechanism in the body? In my hospital, in last 4 years, more than 12 people left in between treatment, especially on the third and fourth day, because they are not able to survive the healing crisis. Why I said that only out of 300, only 12 people left again. But healing crisis is a stage which we have to explain to them very precisely and scientifically so they can sustain. On my experience, I know that is a time very difficult for the people to go through, because there is a change in the track. They are disconnecting from the comfort. They're going through sufferings. I think tomorrow there is a topic by Dr. Babu Joseph Sir about the sufferings, the benefit of sufferings. So that sufferings are because how are you able to say this is how the body reacts? And when you suffer, it says that your body is reacting. It lasts only for 24 hours to 48 hours. The headache, the nausea, the body pains, the fatigue you feel is because of the activation of xenobiotic metabolism. When you say that body can heal itself, are you able to explain the lymphatic system which get activates when you sleep for 8 hours? The difference in sleeping for 6 hours and 8 hours, are you able to explain? The lymph cells in the brain get activates during the dream sleep, which comes only after 4 hours, which gives the toxins and dead cells, the beta amyloid plaques in the brain, which prevents Alzheimer's. Are you able to explain that? Are you able to say naturopathy diet? We always say the alkaline and acidic diet. Are you able to say the connection between the acidic food and metabolic acidosis and the flow chart? I'll show you later. When you explain about therapeutic yoga, are you able to connect up the physiological hypoxia created in the body? When you do a yoga posture, or when you induce a kumbhaka as a deep breathing or a purega or rajaka practice of yoga, these are purpose. The evidence is available there. Are you able to connect? I'll just show two important things which helps you to understand how much important, how much data is available there. It's a chart in PubMed on a paper present in Nutrition in 2017, which say how acidic food leads to drop in blood pH, which leads to metabolic acidosis, which induce different kind of disease like osteoporosis or osteoarthritis, chronic kidney diseases, or deposit of calcium in different part of the body leads to atherosclerosis, block in the heart or in the stroke, or insulin resistance, which leads to type 2 diabetes, or PCOD, or type 3 diabetes, which is Alzheimer's, and increase in cortisol level, stress response, high blood pressure. Are you able to connect these? Are you going to explain this to people? Then the thing is done. They're ready to change. Or are you able to explain the impact of the Shesha Rejaka, the breathe out? When you do a Om chanting, how the brief daily hypoxia induce the growth of vascular endothelial growth factor, or induction of or reducing the BP by production of nitric oxide, or favors stem cell migration, which help in osteoarthritis or Parkinsonism, or induction of P53, the guardian agent which prevent the cell damage and prevent cancer, or which reduces the aging process. When you make a person to do Nadi Shuddhi Pranayama, are you able to explain how a brief hypoxia is created in the body during that, and which stimulate these physiological changes, which makes the body to go to a hemodynamic state and come back to normal and induce the healing process? So if you have these things, then these are the basic requirement to run a naturopathy hospital. Nothing else is required. So when you look into this, we are the most blessed physician in this world, because everyone else required external support to heal a person. We need only our knowledge and ability to communicate. When you do online consultation, the online consultation charge of my hospital is 9,500 rupees. People take that for a one consultation, a follow-up and a review, which almost lasts for 2 hours, everything together. People are ready to pay for that, even for an online consultation, if you are able to convince that going to make a change in your life forever. So when you explain the dietary concept, are you making something very miserable for them? Are you making these are the things which I say to the patient come to my hospital. Don't eat anything which you don't like. I tell to them, whatever you eat, without you like, is going to be a poison. It is not going to work as a medicine for you. And eat with your 5 senses. A food should be appealing for them when you see it. When they touch it, when you smell it, when you eat it, it should be appealing. Tongue, taste come last. How important you're giving to presentation. I'm giving assurance to the people, you can eat as much as you want, because I know that you can never overeat a natural food. I know that. I explain to them, when they eat a natural food, the inflammation comes down, the leptin-ghrelin balance will come back, so you cannot overeat more than second day. Are you able to demyth the facts about carbs and fats? People avoid the yellow of the egg and eat only white. Are you able to say how important it is to eat holistically? What is a healthy fat and a bad fat? And I say to them, food is not medicine. I told them food is not a medicine. Food should be eaten as food. I explain to them with a very simple concept of an apple and a ginger or a garlic. When people come to, we consider garlic as a medicine, and many of us ask people to eat curcumin because we say it has handy immunity properties and immune boosters. But on a realistic sense, a ginger or a garlic or a turmeric is not our food. If you come to my house, when I give a plate of apple and people of turmeric, what do you eat? You eat only apple because apple attracts you. So your food is what attracts you. You can include ginger, garlic, or anything for a specific purpose, as I said in my first or second slide, to suppress a symptom, not for healing. When a person is getting indigestion, when you're giving a ginger decoction, you should understand a person is getting indigestion not because he didn't take a ginger. You may use that for symptomatically for 1 hour or one time, not every day. The disease aggravates gradually. So I believe food is not even a medicine. Food should be just food. Food is a communication from the external world to the body. And it depends on what communication you give the body. Are you giving the right communication? Or is it anti-inflammatory or a pro-inflammatory is a question. As acidic or alkaline, what is the communication you go into the body to the food? That's a question. So this is a raw food we give Malayalis or someone who being in Kerala. No, this is a sadhya, traditional feast of Kerala, but we give in raw food. None of the thing here is cooked here, what you see there. But see, look at the presentation, look at the color. I believe it again, fresh, live, wholesome rainbow food. So I just present with all these things, with that minimum setup, with that rate, how much patient we get in 2019. I took the date of 2019 because 2020 we operated with less capacity, lockdown in between. See the numbers. So these are only not the numbers. When you have a good marketing team, people may come to you. But how much satisfied you are, the end product is important. This is a rating we do when people get discharged on the medical, treatment, diet, housekeeping, and front office. So as our hospital is established by a well-known hospitality brand, people may get satisfied with the housekeeping or front office. That is natural. But how much satisfaction they have in the treatment, diet and diet, treatment, medical side, treatment and diet. Out of 5, it is more than 4.5 for everyone. See the average. It's average I'm showing there in 4.8 and 4.6. So look at the index, the person satisfaction index in June, July, August, and September 2009. So why I showed these things here, you don't need big establishment. You don't have to invest much. You don't have to have many treatments to get satisfaction of the patient or get a result of the patient. You need only confidence, knowledge, and conviction in the basic principle of naturopathy, which can conduct the science. So yoga and naturopathy, let me wind up. Yoga and naturopathy is all about awakening the healer in you, nothing else. And it is about changing the people from ignorance to awareness. The ignorance which causes disease, bring awareness to them. From laziness to attitude to become a healthy life, and from lack of opportunity to an intention to create opportunity. If you can do that, then you are going to be successful. Thank you.
Thank you, sir. Rightly, you said we really do not need much of investment for setting up any hospital, naturopathy hospital especially, because if we have a right knowledge, if we are skillful, sitting at home with the minimum things, we can do consultations, we can take up yoga sessions, we can go for it. So thank you for highlighting how our upcoming naturopaths can take advantage of your session. And if they want to build up any settings, it will be definitely helpful for them. Thank you, sir, for your informative session and your valuable time.
Thank you.
Thank you, sir. So moving ahead, this was our last session of the today, and tomorrow we'll be joining back at 9:45. Links are already sent to you, so you all the participants and everybody can join at 9:45 sharp m tomorrow. And now we'll be ending up. Thank you for patient listening, and